So I was thinking about this idea of knowing. How do you know something? So I'm trained and taught to do stuff because you know what you're doing. I guess the middle gray area is called an educated guess. What exactly does that mean? You have some information, but not all the information, versus just doing blindly the shotgun approach, where people just do stuff randomly. So starting from the shotgun approach, you think about people who add on medications to treat patients' symptoms. Just keep on adding additional symptoms, more medications. But I think that the gist of it, and most people would agree that you should try to figure out what's going on, what connects all these symptoms, and actually treat that than just putting bandages on all the time, right? If something's bleeding from this and that, right? Yeah, you could put bandages, you could try to hold pressure, try to stop the bleeding, but maybe figure out why they're actually bleeding. It's an important distinction because when somebody's having a code, when somebody's undergoing CPR, sure, there's the aspect of doing CPR, making sure somebody has, oxygenation, stuff like that. But that doesn't fix the problem. You could keep on doing it and they may recover, but there's sort of a low chance. You got to do stuff to try to make them recover. Like it's not just supporting them and hoping they'll recover. It's actually actively working on figuring out why did the heart stop? Why did they stop breathing? So you could work on making them recover. And those are two separate things. And many people focus on, the former and not the latter, actually figuring things out. In fact, I would say that the trend has progressed rapidly in the medical field. When I was in training, in the ICU, docs would try to figure out what went wrong. How can I get this patient better? Now, ICU, they don't need to be in ICU. They're not here. Censor them out. Why were they sick in an ICU? Not really sure. But, somebody else could figure it out. So that was ICU. Then you go forward to the hospitalists, right? They're not in ICU in the hospital. Used to be that many hospitals would try to figure out what's going wrong. We have more resources, we have more time. Let's do some investigating here. But again, that's also changed. And unfortunately, many times hospitals don't figure it out. Well, we'll just stabilize you, make sure you're okay, and yeah, I think your PCP can try to figure things out. And everybody knows that the PCP doesn't have time. They have a panel of 1,500 patients. So the end result is nobody really quite figures out what went wrong. You're better. But will it happen again? We don't know. Could you have some effects down the road? Well, we don't know. And so I prefer to be sort of meticulous. I remember back in my early days, I wouldn't do stuff if I didn't know what I'm doing. I refused to start antibiotics on a lady who had vandemia, 40, 50%, really high. Could be infection, but what infection am I treating? It turned out okay. I ended up starting antibiotics for meningitis, which it was. But I didn't start it before I knew that. And I remember another case where there's a young kid has some muscle weakness. That's really strange. He's otherwise healthy. Not Guillain-Barré. What is it? I don't know. And that's why a neurologist said, can't do anything about it because he doesn't know what it is.